welcome back. So today we're going to be talking about supporting your spouse through hormone replacement therapy. Why are we even talking about this? Well, because I see a lot of patients as an internal medicine doctor that specializes in hormone balancing. I see a lot of patients that come in with symptoms that is suggestive of an imbalance in their hormones. And after we've done blood work and we're able to identify which hormones specifically are imbalanced or low or high or just off, we then recommend that they go on hormone replacement through these different methods. We can use a cream, we can use tablets under the tongue, we can do a patch, we can prescribe it in the form of like a injection. Sometimes it's a pellet that we put under the skin, and there's a ton of different ways that we can replace hormones, and we use the one that is most fits the patient's lifestyle, the one that they're going to be most compliant with, the one that's safest for them, especially given their other medical conditions or other prescriptions that they might be taking at the time. So once we decide which method works best for this patient, we start them on therapy. But I always encourage my patients to engage and involve their spouse in the therapy session or in the decision-making process, because you do need support when you are going through hormone replacement. In fact, one of the things that brings a lot of patients to the clinic is because their spouse is letting them know that something is off. Like it's either maybe their mood is more irritable, maybe they're not sleeping through the night, maybe they're having night sweats, maybe they're just very irritable and kind of complaining about a lot of stuff to their spouse or their partner. And some of these are the things that actually prompts the patient to come in. So once this patient is now getting therapy, one of the things that we sometimes talk about is the fact that they have to be patient with their spouse. Sometimes when a patient starts to feel better after feeling crummy for a long time, they are so excited about how much better they feel that they kind of want to push the other spouse to come in and get checked and kind of get on the same page. And everybody has to be ready for their transformation when they're ready. So supporting your spouse through hormone replacement therapy goes both ways. It means you that are receiving the hormone replacement therapy and the person that is not receiving the hormone replacement therapy have to be supportive of each other. So when you start your therapy and you're feeling great, what you don't want to do is nag at your spouse and try to get them to come in because you're feeling great. Maybe they still have their reservations about maybe something they've read, maybe their family history, maybe a friend of theirs that went on hormone therapy and didn't have the best results. They might still have their own reservation that they need to work through. So I encourage my patients that they should let their spouse get to that decision at their own time. Yes, let them know how much better you are feeling, what is improved for you, and how it's helping you, but that's it. Don't push them to go get tested when they're not ready. Just let it happen naturally. In fact, what tends to happen is I end up seeing most patients as their spouse, because once your partner starts to see that you're sleeping better, you're losing weight, you're more energetic, you're more interested in having intercourse, well, that might actually start to encourage them, like, wow, she's feeling that great, or if he's feeling that great, maybe I need to go check and see that everything is okay with me as well. So when your partner asks you to then say, oh, maybe I should make an appointment with your doctor, that's the best time to then have that conversation, as opposed to like trying to push it on them to do it and go get checked and go get it done, because now they don't want to do it because you're kind of forcing it on them. So hormone replacement is something that each person has to research on their own, have to get to the point where they feel that this is the safest thing for me to do right now to help improve my health, to help improve my longevity, and so on. So I encourage you that even as you're starting to feel better, to be very careful about how you're pushing or maybe suggesting it to your partner, but be supportive. When they're ready, definitely be there for them. Explain to them how much better you're feeling or how much better you're not feeling, so that they can also go through that process of making that decision on their own. I hope this has been helpful, and because this is a question that I get a lot of times where some patients want me to talk to their spouse, maybe to encourage them to come in, and I'm like, no, they're going to get to that decision on their own, but I can only educate and continue to put the information out here so that they can also learn on when it's appropriate for them to get help regarding hormones. I hope that's helpful. If you agree or disagree with that, I would love to hear your opinion and see how you would address it in your situation.